Hello, everyone. Today we're talking about hyposecretion, hypersecretion, pathologies of the endocrine system, and what that might look like. You are in luck today. I have a meeting in less than 30 minutes, so let's see if Mrs. Ellis can do this in less than 30 minutes or have to re-record for a longer lecture. All right. So, primary mechanisms of endocrine disease. All right. There are a lot of ways that pathologies can occur within the endocrine system. The main thing that we're concerned about usually is hypo or hypersecretion. If too much is produced of a hormone, it's hypersecretion. If too little hormone is produced, it is called hyposecretion. All right. Hypersecretion can come about a couple of different ways. Sometimes tumors are responsible for a ton of endocrine cells to proliferate. They just grow, they metastasize, and it results in an increase in hormone secretion because now there's a whole bunch more endocrine tissue than what there was before. Another cause of hypersecretion is autoimmunity. All right. So there's an abnormal functioning of the immune system. And then suddenly we have this massive flux of hormones dumping into the system. Another cause is a hormone hypersecretion is a failure of the feedback mechanisms. All right, remember those feedback loops that regulate secretion of a particular hormone. If there's a breakdown in that information cycle in that feedback loop, then the gland is never given the instruction to turn off that secretion. There's also hyposecretion. So, although tumors can cause oversecretion of a hormone, they can also block things up and cause undersecretion of hormones as well. There might be tissue death in a gland caused by a blockage or failure of blood supply. That will reduce hormonal output. It's almost like someone is stepping on a garden hose. You're going to have less water coming out. Another way that a gland might reduce its secretion is through abnormal operation of, again, the regulatory feedback loops. All right. Like men who take anabolic steroids, they stop secreting their natural testosterone. Men who take testosterone steroids increase their blood concentration of testosterone above set point levels. And so their body is like, oh, I don't have to make this anymore. You're getting all this synthetic stuff. So I don't have to anymore. So it reduces its own output of testosterone and gonadotropins, which leads to potential sterility and other complications. Abnormalities of immune function may also cause hyposecretion. An autoimmune attack on glandular tissue sometimes has the effect of reducing hormone output. Um, Research has also shown that hypersecretion disorders could be caused by insensitivity of the target cells to pituitary tropic hormones rather than actual hyposecretion. All right, that sounds like a lot of words. What does all that mean? Remember, the pituitary gland sends out tropic hormones. What are tropic hormones? Those are the hormones that tell other tissues to produce more hormones. They're the middle manager, right? Your hypothalamus is the CEO. It sends information to the pituitary gland that sends out tropic hormones. Tropic hormones are the middle managers that go and tell the laborers, which are your regular endocrine glands and hormones, to go do the work. Well, the manager has fallen asleep and has stopped telling the laborers to go do the work. So, because the manager is asleep, the laborers, the hormones, don't go to work because they don't know that it's time to get started on a particular task. So in this case, it's not that the actual endocrine gland like the thyroid or the thymus or the pancreas or the adrenals, it's not that they don't want to secrete what they need to secrete or that they can't. It's that they're not being told to secrete it properly. And so we have this hyposecretion issue, even though there's nothing physiologically wrong with the endocrine gland associated with that hormone itself. All right. Sometimes endocrine disorders are not caused by the glands themselves. That's what we were just talking about, but there are other things. Some cancers can produce hormone like substances that cause endocrine syndromes, We're tricking the body, just like these men taking this false synthetic testosterone, shut off their own testosterone. Silly, silly. Some cancers will actually produce some secretions that are hormone-like in that manner as well. Sometimes your adipose tissue can do that as well. It secretes ton, a ton of hormones. You can also have a decrease in the number of hormone receptors. All right. So you may be producing the hormones, but the hormones have to lock in, sort of like an antibody in the immune system. It has to be able to lock in. And if that can't happen, the hormonal action doesn't occur. If you don't have the right lock for the hormone key to fit into, guess what? That door is not going to open because it's the wrong lock on there, or that lock is defective. All right. Target cells may also have abnormal metabolic responses to the hormone receptor complex. All right, endocrine disruptors are something definitely worth mentioning. These are environmental substances that alter the function of the endocrine system. They produce an adverse health effect. All right, these are contaminants in the environment, created usually by us. Yay! These mimic the actions of endogenous hormones, all right? So endogenous inside the body. They are now prevalent in the environment, and human exposure is linked to chronic diseases such as obesity and diabetes, inflammatory and autoimmune conditions. We hear a lot of things about BPAs. That is indeed a major issue. Unfortunately, the FDA does not regulate things like your cosmetics or things that you put in your mouth in terms of supplements. And they don't regulate things like soaps and sunscreens and massage lotions either, or cookware, which is where a lot of these BPAs come from. There are a ton of forever chemicals in the things that you use. Please be aware of that. Please be aware that they can completely disrupt your endocrine system. And a fascinating side study, I will not go off on this tangent, but learning about the estrogen increase and the testosterone decrease in males of nearly all mammalian species, as well as other types of animals, but especially humans over the last several decades, is absolutely fascinating to learn about. Talk to me if you want to learn more about that, but that's a little bit aside from massage. So we shall move on to functions of the pituitary gland and the diseases of such. All right. They include acromegaly and gigantism. These are both related to hyperpituitarism. All right. Dwarfism is hypopituitarism, and also diabetes. Gigantism is an overproduction of growth hormone during the childhood years before the onset of puberty. All right. So this is when your bones are still growing, the growth plates haven't closed off, the epiphyses. All right. So the long bones just continue to grow and grow and grow. They also might have an arched palate and slanted eyes as things continue to grow in the face. These are some examples of gigantism in the hands. When you massage people that have been affected by gigantism, inquire about pain levels, because enlarged joints can cause severe pain issues in these clients, and it puts considerable strain on the associated muscles. Acromegaly is also a hyper secretion issue of growth hormone. Acromegaly is an overproduction of growth hormone during the adult years, after the onset of puberty and the closing of the epiphyses, right? The end plates of these bones, causing cartilaginous and connective tissue overgrowth, and results in coarsened facial features, jaw protrusion, thickened ears, a nose and tongue, and broadened hands with spade-like fingers. All right. Acromegaly is usually caused by pituitary tumors, and those can actually develop. They become metastasized from tumors in other parts of the body, such as the lungs or the pancreas. All right. The number and size of skin glands tend to be higher and larger than normal, leading also to thick, coarse skin and increased body odor. So in this case, this is not a hygiene issue. This is, unfortunately for them, a symptom of acromegaly. All right. This person often experiences generalized pain because of the stress of the larger, heavier structures his or her body must support. And there is associated muscle weakness and reduced exercise tolerance will also occur. So, same thing as gigantism, you need to talk to them about pain levels before each session. But please be aware there's usually a lot of coexisting medical conditions with this, potentially carpal tunnel syndrome as everything thickens in here because this is already a tight, inflexible tunnel anyway. Arthritis, diabetes, all of these need to be factored into your treatment plan. Dwarfism is an underproduction, so it's a hyposecretion of growth hormone in childhood, causing short stature. All right. It is hypopituitarism. All right. There's disproportionate dwarfism, and that's when some parts of the body are small and others are average size or above average sized. You could have someone with a very large head, feet, hands, and genitalia, for example, but the trunk and the appendages of the body are very, very small. And there's also proportionate dwarfism, and that's where the entire body is proportionately small or of the same degree. It just looks like anybody else, just of a very smaller stature. All right, consider incorporating myofascial release techniques into the session to improve treatment outcomes. Helps with stretching out this connective tissue. Also, be sensitive to terminology. Sometimes they prefer little people or short stature rather than dwarf or dwarfism. It really depends on your client and how they identify with this particular pathology. So please be aware of that and be sensitive to that when communicating with your client. Not only these clients, but any client that has any exceptionality. Please make sure that we are naming it and treating it in the way that they feel respected. Diabetes insipidus is a disorder in which the kidneys are unable to retain water. So you just pee a bunch of dilute urine all the time. You don't have enough waste product in it. You're not holding onto your water. You are just a literal fountain. There are a couple of different types. These are caused by an ADH deficiency. All right. There's also ADH resistance by the kidney tubules. All right. That's antidiuretic hormone. ADH, antidiuretic hormone, is the chemical produced in the brain that causes the kidneys to release less water, decreasing the amount of urine produced. All right. This affects your blood pressure. Remember, we talked about turgor pressure before, where the more water pressure you have, that's called turgor pressure, the more your blood pressure rises. That's why if you have really low blood pressure and you go to the ER with something like septicemia, they start giving you fluids right away because they want that blood pressure up. They want your heart and your cardiovascular system to remain functioning, right? So if you have a problem with this antidiuretic hormone, you have diabetes insipidus. All right. The person can become dehydrated really easily, which here is called poor tissue turgor. All right. You're losing a degree of skin elasticity. You'll get dry mucous membranes and muscle weakness, and fatigue and irritability also go along with this. Suggest that the client use the toilet before the massage if they have this condition as a comfort measure, and be prepared for a toilet break during the session because of increased urination, especially when you're doing lower back work and putting pressure on that bladder. Make sure that you have a clean and private pathway to the bathroom. Map that out if you're working in a shared space or a spa for clients that have this. Offer water to help keep the client hydrated. Please be aware if you offer them water before the massage, about 30 minutes in, they are most likely going to have to urinate. All right, the thyroid. We're going to talk about hyperthyroidism and hypothyroidism. All right, there is Graves' disease, which is hyperthyroidism, and that is an overproduction of thyroid hormones called, again, hyperthyroidism. Graves' disease is also called thyrotoxicosis. Let's try that again. Thyrotoxicosis. All right. Disease manifestations include anxiety, hand tremors, weight loss, despite increased appetite and food intake. Why? Because their metabolism is shooting up, okay? Remember that thyroid controls a lot of those functions of metabolism, and it's excessive. You now have excessive metabolism happening. You're going to get diarrhea, fatigue, insomnia, tachycardia. You get flushed and warm skin, a lot of times with a ton of profuse sweating. You get heat intolerance. You get really sensitive in warm temperatures. You get brittle hair. Your hair starts to go, and you can start developing a goiter. All right, that's an enlarged thyroid gland. It'll start developing right here. It won't be like Mrs. Ellis's double chin. It'll be like a large bulge in the middle of the neck. All right. Goiters are usually painless. Large goiters can cause difficulty swallowing or breathing. Two other characteristics are bulging eyeballs and thick reddened skin, usually on the shins and the tops of the feet, called Graves' dermopathy. All right, so you're going to customize the massage according to the client's presenting symptoms. Avoid use of hot packs, heat intolerance, hot immersion baths, and table warmers because of the likelihood of heat intolerance. Also, the incredible amount of sweating that's present. We also have Hashimoto disease, which is hypothyroidism. That is an underproduction of the thyroid hormones, causing a generalized decrease in the body's metabolism. Hashimoto's disease is also called Hashimoto thyroiditis or chronic thyroiditis. All right. This is usually accompanied by fatigue, muscle aches, pain, stiffness, weight gain, slowed mental processes, cool, dry, and scaly skin, loss or thinning of hair. You can also get a goiter with this one as well as excessive edema of the face, hands, and feet. All right. So please watch out for these. You are going to massage to the client's comfort level. In this case, you might want to use the table warmers and things of that nature because of their cold intolerance. They may have non-pitting, the edema might be non-pitting and boggy, so that'll cause changes in the face, like a bulbous nose will start developing and swollen lips. Thyroid cancer is a malignant tumor in the thyroid gland. Of course, you're going to treat this client like you would most other cancer clients, where it's really just dependent on their treatments, their symptoms with the treatments, and doctor recommendations. This could cause either hyper or hypo secretion, depending on what is happening. Please note that salivary gland dysfunction, all right, salivary gland dysfunction is a side effect usually of thyroid cancer treatment. Just throwing that out there. All right, parotid gland massage. I threw this in here if you guys want to see this. This is pretty interesting stuff. I don't think I've ever done this. I've done a lot of intraoral work for TMJD issues, which is one of my favorite things to work on, but I don't think I have ever in my career specifically done massage for the salivary glands. And now I'm super interested. So hopefully this time next year by the time that all of you have graduated, maybe I'll have found a client that needs this done because this sounds super interesting to me. The slide is here if you want to download it and see it. Diseases of the parathyroid. All right, hyperparathyroidism is an overproduction, surprise, surprise, of parathyroid hormone causing high levels of calcium in the blood called hypercalcemia, loss of bone density, and increased susceptibility to fractures. Osteoclast activity in bone increases and calcium is moved into the bloodstream, causing bones to demineralize and become fragile. All right. This is sort of like osteoporosis. It's characterized by pathologic fractures. Remember, that is a fracture of the bone that is caused by pathology, not an injury. It's a fracture caused by disease or pathology, all right? Not an injury, pathologic fracture. Bone deformities, muscle weakness, joint pain, fatigue, hypertension, abdominal pain, loss of appetite, It continues. Peristalsis is also decreased with accompanying constipation. So if you have a client with hyperparathyroidism, you have to be very, very gentle and light because of the bones, but you could also incorporate a lot of techniques to help alleviate that constipation. So I would highly recommend incorporating abdominal massage. They are likely to have bone, joint, and muscular pain associated with the condition, and possibly have developed osteoporosis as a disease complication. Hypoparathyroidism obviously is an underproduction of the parathyroid hormone, causing low levels of calcium in the blood called hypocalcemia, and an increased risk of tetany. Tetany is muscle twitches or cramp-like spasms, usually from calcium deficiency. These can be prolonged and painful. I don't know if any of you have ever had a Charlie horse or had your calf suddenly seize up on you and snatch your soul from your leg. All right, that's what that feels like. They may have painful muscle tension, spasms, grimacing, throat spasms. When spasms occur in the throat, they can interfere with breathing, causing a medical emergency. So if you have someone with hypoparathyroidism, please be aware that those spasms don't just happen in large skeletal muscles. They can indeed happen in the throat, and you could have an immediate medical emergency on your hands. All right. Use of emollient lubricants might combat dry skin in these individuals. Observe them for signs of acute tetany. All right. These muscle spasms. Look for twitching. You can literally see the muscles twitch or breathing difficulty. If they show any signs of that, any signs of choking from muscle spasms in the throat region, clearly call 911. Adrenal cortex issues, Cushing's disease and Cushing syndrome. This is hypercortisolism. Cortisol, the stress hormone. Cushing disease and Cushing syndrome are both caused by overproduction of cortisol called hypercortisolism. Signs and symptoms of both conditions are the same. There's a little bit of difference between Cushing and disease and Cushing syndrome. This is caused by an overproduction of ACTH by the pituitary in the disease. In Cushing syndrome, it's an overproduction of the adrenal glands. All right. So one is the tropic hormone. It's coming from the CEO. The second one is coming from the manager, okay, telling the workers what to do. But the same thing happens. One of the two higher ups is misdirecting what's going on. Very often the person develops a moon face. They might get acne, puffy eyes, a ruddy complexion, thinning scalp hair. Affected women might experience growth of facial hair similar to PCOS. They might start developing fat and fluids on the upper back, usually called a buffalo hump. Isn't that attractive? You already feel awful. Now you have a buffalo hump. Typically, the arms and legs remain thin. You also can get hypertension, which remember is high blood pressure. We talked about tachycardia earlier. Remember that's increased heart rate, reduced bone density, and osteoporosis, which really sucks because you're also gaining weight and you're putting more stress on those bones. Hyperglycemia and adrenal tumor formation usually occur with this. Be aware the skin becomes thin and fragile and is easily bruised. Act like the skin of these clients is the same as a 95-year-old. The skin becomes thin and fragile and is easily bruised. All right. They may have bone, joint, and muscular pain associated with this condition. So please be aware of that and work around those conditions accordingly. Addison's disease is hypocortisolism, and that's an underproduction of cortisol, causing a range of problems. It's also called adrenal insufficiency. There is primary adrenal insufficiency from cortical damage, usually because of an autoimmune response. And there's also secondary adrenal insufficiency. And again, that's when the CEO fails to give us proper directions. That's when the pituitary does not produce enough of the tropic hormone, telling the adrenals, the managers, to produce the amounts of the cortical hormones, the laborers. Okay. There's usually general weakness and fatigue, GI disturbances such as nausea, vomiting, abdominal pain, diarrhea. You'll have cold intolerance. You might crave salty foods if you have reduced levels of aldosterone with this. Consult with the client before massaging to work on them. If they chill easily, make sure like hypothyroidism, you provide table warmers and heat, a blanket, electric table warmer, something like that. To help warm them up, all right? You're going to be thinking of all of these things to sort of excite the sympathetic nervous system in these clients. Cortisol is enacted with excitement of the sympathetic nervous system. Usually massages exciting the parasympathetic nervous system. So we want to make sure that we kind of kick them into gear a little bit. I love this image from your book. It's the comparison of Addison disease and Cushing syndrome. So feel free to pause and look at it or download the PDF when I put it on your weekly page to check it out. I think this is one of the more interesting comparisons of what would have been the same woman with either disease. Diseases of the pancreas, diabetes. Diabetes. We have separate information about diabetes, but just be aware there are 3 types of diabetes. Diabetes type 1, caused by insulin deficiency, diabetes type 2, caused by insulin resistance, and type 3, which is gestational diabetes, which occurs during pregnancy, all right? We will talk about that more in depth at a later point in time. Just know that diabetes is affecting your blood glucose levels and your ability to utilize that glucose appropriately, and can cause things like hyperglycemia, which is increased blood sugar, which is a major issue, and hypoglycemia, which is low blood sugar, which can lead not only to terrible symptoms, but to diabetic coma, potentially even death. All right. With diabetes mellitus type 1 here, it's an autoimmune destruction of pancreatic beta cells resulting in insulin deficiency. You usually get polyuria, which is excessive urination, polydipsia, which is excessive thirst, and polyphagia, which is excessive hunger. All right, so you want to eat, you want to drink all the time, and then you're peeing all the time because you're drinking all the time as well. All right. Usually these clients will be wearing a continuous glucose monitor. So make sure that you talk to them and avoid that, especially with oils, that you're staying well around it so you don't mess with the adhesion of their device, but you can otherwise massage them like any other person. If they start to show symptoms of hypoglycemia, such as visual disturbances, tremors, cold, clammy skin, offer them a sugary snack or something that they find appropriate to eat. If it does not resolve within a few moments, like a few minutes, it could be something worse, like a heart attack or going into a diabetic coma. In that case, you need to call 911 immediately. All right. Here is a chart. I do want you to pause and look at this. This will be on your quiz for this lecture, okay? Hyperglycemia and hypoglycemia causes, signs, and symptoms. These are important for you to know in daily life. They're important for you to know for your practice, and they're important for you to know for your MBLEX. All right. Again, with massage and insulin pumps, make sure that you are working around those with your client.